Hey, how are you?
Um, well, thank you.
My name's Andrew.
My name is Nancy.
Hey, Nancy. Um, I'm going to be conducting a exam of your cranial nerves and your swallowing function. Would that be okay with you?
Yes.
Okay. I'm gonna get started and just wash up my hands really quickly. All right. So we're going to be doing a few different tests that will kind of check on the function of your cranial nerves. But first, I'd just like to get a little bit of your history, and I'm gonna have my laptop here, just kind of taking some notes as we go, if that's all right.
Sounds good.
So we're mostly talking about swallowing, but first, I just kind of want to back up and ask you if there's anything in your kind of recent medical history that would impact your swallowing, or anything you think I should know about.
I can't think of anything that has occurred that would make it different.
Okay. Um, have you noticed any choking whenever you eat?
I don't think so.
Any abnormal coughing or beyond the normal amount that you would
No.
observe? Okay.
No.
What about just things, kind of food getting going down the wrong pipe? You take a drink or eat.
I don't do that very often.
Okay.
In fact, I can't recall that happening
All right.
recently.
How about whenever you swallow, does food ever get stuck in your throat? Kind of just feels like it's stuck there.
No.
Okay. What about farther down, almost in your chest? It kind of feels like it's stuck right there in your chest.
No.
Okay. Any history of it coming back up, not being able to swallow and having the food come back up?
No.
Okay. Um, what about different consistencies? Have you noticed any swallowing problems with, I don't know, something, a strange consistency, puree or a smoothie or anything hard or?
Like, would there be a difference? Is that what you're asking me?
Yeah,
Would
have
there
you
be a
noticed any difference in your swallowing, your ability to swallow with different consistencies?
I don't think so.
Okay. Pills. When you take pills, have you noticed any problems getting those down?
Well, I've had to take an antibiotic, like a month ago, and they were very large
Mhm.
pills. But I didn't seem to have any problem getting them down.
Okay.
It was a large pill. It was an antibiotic, and I don't do that very often.
Okie doke. Any pain occurring whenever you swallow?
No.
All right. Good. Sounds like your swallowing's kind of on track as far as you know.
As far as I know, I would say yes to that.
Okay. Good. How about saliva in your mouth? Have you noticed that your mouth is really dry, or you have a lack of saliva?
I think sometimes at night,
Mm.
my mouth will get dry.
Okay. Have you noticed how long that's been going on? How long, maybe?
Mm, maybe, mm, well, possibly, I'll say 8 or 9 months.
Okay.
I'm just sort of guessing.
Sure.
I'm not sure, but
Yeah, best guess
for a
is
while, I think that happens. But yeah,
great. Yeah, just a little dry mouth
right,
at night. Want a drink?
right.
Okay.
Get a drink. Get up and get a drink.
Yeah. How about any other pain in your neck or your throat?
No, no, not really. Uh, and I don't get a sore throat that often.
Okay.
You know, like with a cold
Right.
or something. I don't get that often.
Okay, good. Any problems with chewing or your teeth?
Not really.
Okay. How about kind of a feeling of something just kind of stuck in your, like a lump in your throat?
No, I don't believe so.
Okay.
I don't think so.
Have you had much acid reflux, heartburn?
I never have I don't recall really having heartburn, and really not. I don't think much acid reflux.
Okay.
Either.
Good. All right. Do you use any oxygen? Do you have an oxygen tank, or do you use any oxygen?
No.
Okay. Any history of pneumonia?
No.
I assume you never had a tracheostomy.
No, but I had part of my thyroid removed.
Okay.
Years ago. It's been 70, in the mid 70s, I would say, late 70s. I had, they thought I might have cancer of the throat.
Okay.
And was tested for that, and they couldn't determine it, and decided to remove the part that had the little nodule.
Yeah.
So they decided to remove that. So, but that's the only occurrence of that.
Was it found to be cancerous or anything?
No, it
afterwards?
was.
Okay.
It was not.
Benign?
It was benign.
Good.
Mhm.
And that was in the 60s?
No, 70s.
In the 70s.
Late 70s.
So almost 40, 45, 50 years ago? Okay. Any problems after that surgery, or any lasting issues that you've noticed?
I don't think so.
Okay.
No, the one thing they didn't tell me at the time was that I was working, and that I shouldn't use my voice for like 3 weeks. And I didn't realize that before this. That's one thing that I was not advised about. So.
How did you get by?
Well, I wasn't working. I didn't work.
Okay,
During that
you
time.
just had to take it off.
Mm-hmm.
You didn't get through by pantomiming, or?
No, I didn't do that. I thought, I'll be home.
Yeah, that'd be pretty tough. Okay. Have you had any recent chest X-rays?
Probably a couple years ago.
Okay.
They're fine.
Yeah.
I'm pretty healthy.
That's great. All right. Let's talk a little bit about your diet. What are some foods that you like to eat?
What are some foods? Well, let's begin with I eat cereal.
Yeah.
Eggs. I eat the yolk of the egg, which is supposed to be a lot of protein for you, despite what many people think.
Yeah.
Avocados. Beans. Rice. Let's see. I probably could eat a little more fish than I do.
Yeah.
But, I eat a little bit of meat, depends on what it is.
Are there any foods that you avoid eating, aside from ones that you just don't like?
I like just about everything, but I do pick and choose because of either, I don't eat a lot of fried food.
Yeah.
I don't eat, I think I'm eating a little bit more bread than I, sometimes, but I don't, than I probably have. But I try to, minimize what I think is either too much fat in it, or you know, some things that are probably not healthy. Like I don't eat a lot of lunch meat. I eat ham, but it has to be pretty lean once in a while, like for a sandwich or something like that for lunch. Cottage cheese, fruit, and fruits. Um, so.
But you don't avoid any foods. You just avoid foods for health reasons, not because you've had difficulty eating them or anything like that. Okay.
Correct. I try to eat things that are fairly healthy.
Yeah, sounds like it.
I like some sweet cookies, you know, cake once in a while, things like that. No, I don't think there's anything I really avoid, but I try to eat things that are helpful.
Okay. How about the frequency of your meals? You eating, 2, 3, 4 meals a day?
Mostly, I generally eat probably 2.5 meals a day.
Yeah. A little snacking here and there.
Sometimes they say not to do so much of that snacking. I don't know.
Yeah.
Later breakfast probably, and then maybe lunch, late lunch, or then a little dinner. I mean, I'm not really hungry, but I try to, eat a banana, eat an apple, eat some other kinds of fruit.
How about the amount? Are you eating, similar sized meals as you did a few years ago?
Probably not. I eat salads, things like that too, because I think those are good for you. But probably, I don't enjoy the cooking, spending time cooking as much, probably, as I did.
So you say you're eating smaller meals maybe than you used to, or?
Well, probably.
Oh, okay. Have you noticed any changes in your weight? Any increase or drop?
My weight stays about the same.
Good.
Because if I think it is up 3 or 4 pounds, then I try to watch what it is that I'm eating.
Okay.
I've done that all my life.
Yeah.
So why stop now?
Yeah, that's great. Willpower.
Well, I don't know. But I I'm conscious of the weight.
Yeah. It's good.
I don't think it's healthy to be overweight. I could lose a few pounds now, but we'll see. Spring.
I
Spring's
think you're
coming.
in great shape. Yeah.
Spring's coming.
Yeah. Have you ever had to use a feeding tube?
No.
Okay. How about any supplements or vitamins? Take any of those?
How many people are hearing this? No, I don't. Well, I don't. I have taken a few vitamins, but I generally, not as a rule do I take vitamins. I try to get
daily or
the vitamins in food.
Yeah. Okay.
And what I'm conscious, like I know broccoli is good for you, and different things like that. And that's where I try to get my supplements. Is in the food that I eat. I am taking glucosamine right now. It's an over-the-counter medication.
Yeah, that would probably be considered a supplement.
Probably, yes, it is. It is a supplement it's probably to help. And some people, the doctors say it helps your joints.
Yeah, joint function.
Joint function, yes.
Yeah.
But otherwise, no.
Okay. How about your water or liquid intake? Do you feel you're staying pretty hydrated?
I try to do that. Yes,
Good.
water. I'm never shy of drinking water. I think it's good for you. I drink coffee, tea, very few sodas, juices. I drink orange juice and cranberry juice. Those are probably the 2 main ones that I drink. along with water and coffee, tea.
Good. Okay, how about any history of tobacco use?
No, I don't smoke.
Okay. Alcohol or substance abuse?
Uh,
Or I guess use, not necessarily
use.
abuse.
Wine probably. At this point, it maybe once or twice going out to dinner or something like that at dinner, but not
Glass of wine a week, something like that.
not always.
Yeah.
Or maybe a certain kind of beer or something like that once in a while, but not as a general rule.
Okay. What's your current living situation? Do you live at home?
I do.
Okay. You have your own home?
Yes.
Okay.
Uh-huh.
Do you live with anyone?
My husband passed away in 2010.
Okay.
So I am living alone now.
Okay. Are you employed right now?
I'm retired.
Okay. What kind
educator.
Okay.
Right.
Good. Any activities you're involved in? Clubs or social groups?
Oh yes, I have a bunco group. I have a dinner group. I have breakfast groups, dinner groups, those kinds of activities. I also try to keep in touch with family members, either by phone, letters, computer. I have a 96-year-old aunt that lives now, and she is in a nursing home in Michigan. And I, talk to her on the phone, or I try to, send her a letter maybe once a week. Maybe some candies and things like that. I have a sister that it's wonderful to have texting, I can text her. We don't always talk on the phone, but, keeping in touch, nieces, nephews, talking about this game, that game. They live in different states. They don't live in Ohio. And friends, keeping in touch.
Okay.
Celebrations.
That's great. Okay, good. I think that's a really kind of thorough history on you, Nancy. So I'd like to kind of start to move forward with just kind of some of the more exam kind of portions of it all. So first, I'd like to just have you kind of talk a little bit about your voice. How do you feel your voice is kind of quality-wise, maybe on a scale of 1 to 10?
Well, I think, I took voice lessons in my youth, in college. I sang and took voice lessons. So, and I think my voice is strong. I have a strong voice. I taught school for a number of years, and then I worked with, students at Ohio State and staff. And generally, I can moderate the voice, but if it needs to be stronger, I know how to do that. I've read at church. People have complimented me on the quality. They can understand what I'm saying, and they can hear me.
Excellent.
So, I would say it's good.
Yeah, I think so. All right. I'd like to talk a little bit. Let's see. I'd like to take a look inside your mouth.
Okay.
I'm just going to put on a pair of gloves here to do that. Fancy purple gloves.
They are. They're pretty.
Nice.
That's one of my favorite colors.
Let's see. We're a little early for Easter, I think. But this is a good Eastern
It's coming
color.
fast though.
Well,
Going by fast.
tell Mother Nature that.
Right.
But those 50-degree temperatures are supposedly on their way.
Right.
Alright, so, get out a little tongue depressor here, and I'm just gonna, do the typical, what do they tell you?
Stick out your tongue.
And say ah, right?
Right.
Okay. So
You need to do that?
Yes, please.
Okay.
Okay, I'm gonna get my little flashlight here.
Okay.
Take a look. This is bright, so try not to look into it. It's
Okay.
really bright.
Bright light.
Yes.
Gotcha.
They make these flashlights so bright these days. Yeah.
Ah.
Okay.
Ah.
Looks good.
Ah.
I'm gonna stick my tongue depressor in here really quick. Okay. I think it's really good. Do you need any assistance whenever you're, brushing your teeth, taking care of, your oral health?
No.
Okay.
My many crowns.
I didn't really notice too much, but you still have your teeth.
Oh, yeah.
You have dentures
Oh,
or
right.
anything. That's on.
Oh.
Mostly natural, right?
Right.
A little help here and there. Okay. So now we are going to test some of your cranial nerves, some of the nerves in your head. There's different nerves. Some of them control the muscles of different parts of your face and head, and some of them control the sensation that you're going to get. And all of these are involved in swallowing. So we're just going to kind of go through a bunch of them and test them. So we're going to start out, I'm just going to ask you to smile and frown. Okay. You pucker your lips. Okay. Puff out your cheeks. Okay, now keep that air in there. Good. Raise your eyebrows. And squint your eyes together. Okay, now keep them squinted. Don't let me pull them apart. Good. Wrinkle your nose. Okay. You can open your eyes now. Okay, good. So that was the facial nerve, cranial nerve number 7. Next we're going to do number 5, which is the trigeminal branch, or the, so clench your teeth together. Okay, I'm just going to feel up here at your temple and release. Now clench again. Okay. Just kind of open your mouth and do a nice and gentle close. Okay. Okay, now I'd like you to open your mouth. I'm going to ask you to close it, but I'm going to try to stop you from closing your mouth, but you should be able to still close it. Alright, now close your mouth. Good. Now keep your mouth closed, and I'm going to try and prevent you from opening it, so open it. Good. Now I just want to take a look at the opening of your mouth and take a quick measurement on how that's looking. So if you could open your mouth kind of as wide as possible without any pain. Alright. Hold that for a minute. Okay, good.
That's interesting.
Yeah. It's called the aperture.
Aperture.
Yeah, the opening.
Okay.
Like a camera. The aperture. Okay, so now let's take a look at your tongue. That's the hypoglossal cranial nerve number 12.
That's why people don't speak very distinctly, is they don't open their mouths sometimes.
Maybe.
I think.
Yeah, that could be.
I've noticed that before,
Yeah.
they talk.
Closed mouth, kind of mumble. Yeah.
Mumbles.
Alright, so stick out your tongue for me. And bring it back in. Okay. Elevate it. And move it back and forth. Good. Now can you lower it like this? Okay. How about open your mouth and say ga, 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 ga.
Ya, ya, ga, ya.
Okay, good. Let's see. All right, now say pa,
Pa,
ta,
ta,
ka.
ka.
Now we're gonna say them together. Pataka,
Pataka,
pataka, pataka.
pataka, pataka, pataka.
Okay, good. All right. Now we will move over to the recurrent laryngeal nerve. To say, I'm going to ask you to say ah and hold it. Ah.
Ah.
Okay, how about e?
E.
Good. All right, and now let's do a little glide up. Start down low. Ooh.
Ooh.
Okay, how about back down? Ooh.
Ooh.
Good. Can you cough for me? Very nice. And you cleared your throat at the same time, so that's great. Okay. All right, now I'm gonna put my fingers on your throat and ask you to swallow. I'm just gonna kind of feel and see what's going on here. So swallow for me. Okay, good. All right. Now I'm gonna test kind of the sensation of your face by just using this little Q-tip here.
Okay.
So just let me know if you feel a sensation.
Yes. 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 Yes.
Okay, great. All right, and now we are going to test your taste. I'm just gonna get some prepared
Oh,
substances
am I supposed
here.
to know what this is? No?
You're gonna identify it for
Okay.
me.
Identify.
So stick out your tongue and just tell me what you taste. Try to keep your tongue outside of your mouth and not bring it back in. Just tell me if you can taste it. No, nothing yet?
Huh. Salt.
Salt. Good. Alright. Now you got it.
Mm-hmm.
Okay.
Salt.
Okay, how about this one?
I love it. This show does. I don't know yet.
Okay.
Sugar.
Sugar. Yeah.
It's hard to do if I don't touch it with something.
Yeah. Yeah. Alright, let's see about this one. You okay?
Yeah, I'm fine. Again.
This one might be kind of faint.
I don't know what that is, I don't think.
Try again.
Uh-huh. Is it milk?
It's not milk, no.
What is it?
It's pretty faint.
Maybe that's
Can you smell it? It's very faint. It's vinegar actually.
Oh, is it?
Yeah, but it was hard to get that.
Failed that one.
No.
But it might need a little more on there.
Yeah.
I'm saying,
that
'cause
was,
I like vinegar. I eat it a lot on my salad.
Yeah, that was a struggle to get it to taste like that. But
I
anyways.
flunked that one.
All right. How about close your eyes and I'll ask you to smell something
Okay.
and identify this.
Oh, that's pepper.
That is pepper. Good.
I know pepper.
All right. So now we are going to, well, let me ask you about some of your reflexes. So have you noticed that you've been able to, or you have coughed at some point, you weren't trying to cough, you weren't intentionally coughing, but maybe some water went down the wrong pipe or something and you went into a little coughing fit. Have you noticed that?
Not very, it doesn't happen very often, but I think I probably have, probably water maybe, and it happens very rarely, but I have done that, and
Okay.
you know, it clears up.
Good. Okay, that's normal. Alright, and now this is not going to be very pleasant, but I'd like to test your gag reflex.
Have at it.
Okay.
Do I say ah?
No, just stick your tongue out for me. Yep.
Okay.
I'm trying not to, okay, good. Okay. So all your cranial nerves are looking very good. So let's move forward and we're going to just do a couple of tests of your actual swallowing.
Okay.
Swallowing, where I'll just kind of give you some different foods and ask you to swallow them.
Okay. Sounds good.
So I'm just going to grab a few of those right now. I have a little smorgasbord for you here.
Okay. Snack time?
Yeah. Okay. So first, we just have 4 ounces of water.
You want the whole thing down? Drink the whole thing?
Sure.
Or just a little bit?
You think can you drink that all?
Sure.
Okay.
I think so.
Go for it.
It's not much. All at one time?
Yeah, at your own pace. Good. Any discomfort there?
No.
Okay.
I don't think so.
Well, you probably know.
That's fine.
Okay. Alright, now I'm going to do a little bit of pudding. Chocolate pudding.
This really is snack time.
It really is. Alright, I'm going to just kind of dish it out for you.
Okay.
But I'll let you feed yourself, obviously.
Okay. I don't have to eat that whole thing, do I?
No.
Okay, this is it?
Yep.
Okay, I have it. Oh, that chocolate.
Alright, just take the whole spoonful in, yep.
Mm-hmm.
Good. Okay. Now we'll try a banana.
Okay.
So another teaspoon here.
Alright. Banana.
Yeah, you can feel free to just chew that up and swallow it.
It's good.
One of my favorites.
I have them every day, just about.
Yeah, you're good.
I have one every day, just about.
Yeah. Okay, and now let's have a little cereal. Milk.
Okay.
Alright, let me just, you can just get a spoonful of that.
I'm gonna eat a whole thing?
No.
The whole thing?
No, you can just have a
Won't you
spoonful
give
of
me just a clean spoon? I won't eat all of it then. I mean, I'll just take a little bit. Okay, I'll do this. Like this then.
Yeah.
That's pretty good.
Yeah.
Cinnamon.
I think it's very, very faint cinnamon. I think it's just the original, actually.
Is that it? Did I do well?
You did great.
Okay. Well, you're not gonna throw this out, so I'll have to eat it.
Okay. Alright, so how did you feel that swallowing went? Any problems?
I don't think so.
Okay. I didn't see any either.
I think I'm good.
I would agree. Well, Nancy, appreciate you allowing me to take a look and do a little test with you. And I'll let you know if anything comes up, but I think we're in the clear.
All right.
Appreciate it.
Thank you.
Thank you.